The legislature and the governor need to ensure that we get adequate funding for drug and alcohol treatment in general across the board, not just for adolescents, but for adults as well.
But that's easier said than done for Sanctuary Incorporated. Executive Director Millie Lujan and her staff have been trying to get adequate funding for years. It costs upward of $2 million to keep the organization running each year, but Sanctuary officials have been operating at less than $1.8 million for the last year. And when it comes to funding for being the sole provider of drug and alcohol treatment services for the island's teens, Sanctuary has repeatedly asked for $690,000 a year, but only received $320,000 for the last several years. Lujan says the costs, though, have gone up significantly.
We transport them to and from. We feed them 3 meals a day. They're with us 24/7. So all the costs have gone up. We have to maintain our facilities. We have to maintain our vehicles. So all of that has gone up. And in addition to that, the matrix model is a very comprehensive model.
Under a contract with the government back in 2011, Sanctuary billed approximately $20,000 every month. In the last year, that figure has gone up, and Sanctuary now bills that amount every 2 weeks.
If they continue to bill us at 26 something, it would translate to about $633,000 a year. That is almost twice as much as what we're paying. And like I say, comparatively speaking, except for the age grouping, other services can provide that at a very lower cost.
Guam Behavioral Health and Wellness Center Director Ray Vega says he cannot pay Sanctuary above what is legally appropriated because he would be held criminally liable.
So my issue is, what is the reasonable cost of running that department or providing the service for Guam kids? That's my issue. And I don't believe the numbers that they're throwing me is reasonable.
Earlier this week, Sanctuary put Vega on notice that effective April 1st, they would no longer be accepting any new clients to the program, and without any additional funding, they would be forced to shut the doors to their drug and alcohol services, as well as lay off employees. Vega maintains his department is capable of providing the services should Sanctuary stop. It's just another issue of contention between the two entities.
Within a week, I could take care of that.
So you have the expertise, the staffing now?
Yes, in fact, we have certified staff and qualified to do it.
They say that they are capable, but I truly believe that they are not. They don't have the expertise or the background. We are the only accredited drug and alcohol program in the region. We are the sole provider of drug and alcohol treatment for adolescents on Guam and in the region.
Both Vega and Lujan are willing to keep working on the numbers so that Sanctuary can provide the services, but whether they'll be able to resolve the matter before March 31st remains to be seen. Reporting in Manila for Guam's News Network, I'm Mindy Egan.